It is one of the most fatal diseases a dog can contract. It is highly contagious. We're talking about parvovirus. That's our focus today as we speak with veterinarian Dr. Rebekah Hartfield. Good morning and thanks for being with us.
Good morning. Thanks again for having me.
Talk to us a little bit about what is parvo.
Yes, so parvo is a highly contagious virus, as you stated, and how it works is basically that virus attacks that puppy or that dog's white blood cells, and then it also attacks the GI tract, that gastrointestinal tract, and this is what can cause fatalities so quickly. This is a very hardy parasite or a hardy virus. It can live in cold weather. It can live in intense heat. And so it's really hard to get rid of, and it stays in the ground or on surfaces for so long. It's mainly found in fecal material, and that's how that it passes to the dog. And the patients that we mainly see this in, the ones that are most affected are those little puppies that are between 6 weeks and 20 weeks of age. And so this is what makes this virus just so hard, especially to watch as a veterinarian and young puppies go through this. But if your dog isn't vaccinated and they're an older dog, they can get it as well.
Talk to us about the symptoms. If you have an animal that has contracted parvo, what will a person see?
You're going to see lethargy. You're going to see that they stop eating. The big symptoms that you're going to see at home is vomiting, and like excessive vomiting just over and over again, and then lots of bloody diarrhea. That's the big one. And parvo to me just has this we call it the parvo smell, and when you smell that, it's not all the time parvo, but it's a pretty big symptom. So if you see any of these signs, it is so important for just the treatment plan for the veterinarian for you to get your pet in as soon as possible within at least 24 to 48 hours of seeing those symptoms.
Well, go ahead and walk us through the testing and the treatment. And for our viewers, we're going to show a video that is actually a simulation that just gives us an idea of what a veterinarian would do.
Exactly. So first of all, we as a staff are going to take really specific precautions because we want to be protected so that we don't pass that infection on to any other patient that might come into our clinic. And so we're going to gown up. We're going to do a good physical exam on that puppy or that dog. We're going to check mucous membranes. We're going to check just the hydration status. We're going to check a temperature. So after that physical exam, then the next step I usually move to is a fecal. And with that fecal, that poop material, we can set it up and check for any intestinal parasites. Intestinal parasites can also harm the GI system. And if they have intestinal parasites along with parvo, this can make treating parvo much more difficult. The next step is I like to use an Iodex snap test for parvo. It's a pretty simple test. You get a fecal sample and you mix it in a solution and use this special test. And within 8 to 10 minutes, you're gonna have a positive or a negative result. Once we know that that dog is positive, then we move on to what is that dog's white blood cell count. This is really important for the prognosis and as far as just moving forward with the appropriate treatment in your pet. So knowing that white blood cell count is really important. From there, it's up to your veterinarian how they want to proceed, but it is a very intense treatment plan. One thing that I just want to throw out there that a lot of veterinarians don't like to talk about is the cost of this. The cost of treating parvo is extremely expensive. Whether you're a small clinic like me or a big hospital, it takes a lot of work to treat these puppies, so just be aware of that. But then we're going to be doing IV catheter, fluids. We have to hydrate these puppies. That is so important. They're losing a lot of body fluid, vomiting, diarrhea, and we have to replace that. So fluids are key here. And then of course, things like anti-nausea medication, gastroprotectants to protect that intestinal lining is really important as well. And then of course, there's all kinds of other things that veterinarians use to help with supportive care of that puppy.
So if your animal is not doesn't have the shots for parvo, they need to have those certainly as when they're little. Also, just real quick before I wrap, highly contagious. Is it contagious for people?
So it's not contagious for people, no, but just be careful where you take your pet and where you step. Your shoes could have fecal matter on it. Bowls could have fecal matter on it. Anything, just make sure and keep really good hygiene. So it's important for you to keep the area clean and for you to make sure that your puppy is safe, and get your cute little puppies into your veterinarian for a wellness check and to complete all of their vaccines.
Get them vaccinated.
Puppies are not safe against parvo until 3 weeks after their last set of vaccines. So keep that in mind.
All right, thanks for being here. To reach out to Dr. Hartfield, you can check her out on her website, drhartfield.com. Great to see you. We'll catch you again next month.
Thank you.